Hello everyone, myself Dr. Nutan Kumar, consultant interventional cardiologist. So today let's talk about a condition called hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is a condition in which there will be increased thickness of the walls of the heart muscle, so which will obstruct the flow from the left heart chamber to the periphery and different parts of the body. So usually when it's thickness becomes too much severe, then it will significantly obstruct the blood flow to the different parts of the body, mainly the brain. So it will cause you dizziness. It will cause symptoms like fatigue, difficulty in breathing, and chest pain, palpitations, and blackouts. Also, it can in the severe condition it can also cause a cardiac arrest. So usually the incidence of this hypertrophic cardiomyopathy is around 1 in 500 in world. But it's more common in India, being 1 in 400 population. So this is one of the most common condition also, which can cause a sudden cardiac deaths in a young population. Recently, or a few years back, you must have seen one of the footballer has collapsed on the ground while playing football. After he has been taken to the hospital and been diagnosed as dead after doing the echocardiogram. So we could see that there was increased thickness in the heart muscle, later found out to be the hypertrophic cardiomyopathy. So it's such a serious condition which can't be neglected. So usually, as I told, the patients will present with symptom of difficulty in breathing on walking for short distance, or palpitation, or giddiness, dizziness, or blackouts, and also loss of consciousness, and also fatigueness. Also, sometimes like sudden arrest they may develop. So this is due to the genetic conditions, due to some genetic mutations happen during death. So that is the reason which will cause this increased thickness in the heart muscle, which will obstruct the flow of the blood. So always, if you have a family history of any sudden heart disease, sudden cardiac death in young age, or any family relative having been diagnosed as a hypertrophic cardiomyopathy, definitely you should undergo a genetic testing for hypertrophic cardiomyopathy. If genetic testing comes positive, then you have to undergo a serial echocardiography every year. So this can be easily diagnosed with the echocardiogram, and once confirmed as hypertrophic cardiomyopathy, then you have to start your medications regularly. So most of the patients can be treated with medications taken regularly, but only few patients with the severe obstruction for the flow of the blood from left chamber of the heart to the periphery. So they may need surgeries like open heart surgery with removal of the extra thickness of the muscle, like myectomy, and some of the patients can also undergo the advanced treatments like alcoholic septal ablation or radiofrequency ablation. And few amount of patients with especially history of sudden death in family in young age, and in history of any hypertrophic cardiomyopathy in their family, and the history of any abnormal heartbeat, abnormal heart rhythm, increased heartbeat or palpitation. So they may require implantable cardiac defibrillator insertion, which will be inserted under the skin, and it will give a shock if you have any abnormal rhythm at any point of time. It will be sensing and giving a shock and save you from a life-threatening arrhythmia, what we call it as like VT, ventricular tachycardia and all. So today I have to give you a message that if you are an young individual having a family history of hypertrophic cardiomyopathy or with the positive genetic testing, so you should undergo regular echocardiographic monitoring yearly and get your genetic testing done. If your genetic testing is negative, you can be assured you can live your life freely, that you are not going to get this hypertrophic cardiomyopathy. If your genetic test comes positive, then definitely undergo serial echocardiogram and advise your other first degree relatives, also first degree relatives of the hypertrophic cardiomyopathy, to undergo genetic testing and to confirm whether they have a gene which can cause hypertrophic cardiomyopathy in the future. Also, never neglect your symptoms like dyspnea, as I told, all the symptoms, palpitations and giddiness. Consult your doctor as soon as possible once you diagnose it, once you first use such symptoms, and get treated early. No need to get panic, or no need to get worried if you have some symptoms. Just go to your doctor and get confirmed what is the diagnosis, what is the reason for all these symptoms. Don't scary to Google it and get worried about all the symptoms and get self-diagnosed because that is the most common thing which the young people do. Consult your near cardiologist, get an ECG, get an echocardiogram, get regular important blood checkups, and assure of your whatever symptoms is causing you whatever the reason for your symptoms, and get treated early. Thank you.